Hi everybody, it's Dr. Julie Keene. I wanted to talk today about the idea of executive functions because it kind of is a broad term. We sort of throw it around. It's becoming one of those pop psychology sorts of things where we use the phrase, but it's really important that we understand what that means. Now, let me be clear. I am not trained as a neuropsychologist. There is very specific training required for that. But just because the training is more complete for a neuropsychologist doesn't mean that a generalist like you and me, I'm presuming you, but definitely me, can't understand at least the basics of what executive functioning is. And that can include qualities such as attention, concentration, planning, organizing, emotion regulation, inhibition, the ability to kind of hold back a practice response in favor of a novel response, right? That mental flexibility that we need to be able to change course and do something different when asked. All of these are really important in terms of identifying where we have strengths and weaknesses. Now, when we talk executive functioning, it tends to be synonymous with something like ADHD, right? Like that's the thing we were all thinking. Yeah, I know you're nodding over there. I know that you thought that's what that was. Executive functionings, though, are things that we all experience. We all have lapses. We all have strengths. When you have an abundance of of challenges around these things, when we have an abundance of challenges around these things, yes, it can lead to a diagnosis like ADHD. But you may also see deficits in executive functioning in depression, in anxiety, in head injuries, all sorts of different areas that we would want to know where those strengths and weaknesses are. Why? Because it helps us plan recommendations and strategies for those clients so that we are really targeting those areas where they're showing deficits so that we can boost those skills. So you don't have to have ADHD specifically to have recommendations around building skills in your executive functioning where you have some deficits. We can build those even if there are some lapses here and there. It's not a whole full constellation of something. We can still do something about. By looking for those executive functionings, we are better able to recognize where the deficits are and build skills so that we can make improvements in those areas.